At Pureform Radiology, we do follow the Canadian Association of Radiology guidelines, which says that for asymptomatic women, annual screening should start at 40. Ages 50 to 74 should be screened every 2 years.
Pureform, we believe and know that annual screening saves lives, period. The smaller the breast cancer is upon detection, the better the treatment options are, and the longer the survival.
Annual exams are really important to catch anything that's going on early. I hadn't been in for a mammogram in 3 years when my cancer was detected, and by the time that it was detected, I had a tumor that was stage 3, which had spread through 5 of my lymph nodes. Terrifying time, but at the same time I felt really supported by the people at Pureform.
So many patients come in scared and nervous and just don't want to be here. We totally understand that. We want to make sure everyone is as comfortable as possible. At Pureform, we want to make sure we get the best images, so we position very carefully and we apply that compression slowly to make it more comfortable. We work together with the patient as a team. Our patients leave saying that they had a good experience and that it was better than they expected.
I know that some women are afraid of having mammograms, and you really shouldn't be afraid of a mammogram. It's not painful. It really isn't. It's slightly uncomfortable, and chemotherapy, radiation, and mastectomies hurt a heck of a lot worse than a mammogram, and a mammogram can save you from all of those lucky things later.
Well, breast density has always been an issue. The denser your breast tissue is, it actually increases your risk of breast cancer marginally, but it does increase the risk. And number 2, it's more difficult for us to see the cancer hiding in the dense breast tissue.
A breast density score is something that would be on your mammogram report. So the reason knowing this is important is because your breast density is often, higher density is often white on a mammogram, and sometimes cancers can lurk behind there and that you can't see. At Pureform Radiology, all of our mammography machines are equipped with software that classifies breast density, which is included in your report. If high breast density is determined on your mammogram, our radiologist may suggest a mammogram every year, as well as a breast ultrasound as an additional tool for early detection. Please speak with your healthcare provider about breast density, family history, and your risk factors, and then decide what is right for you. So a breast screening party is something that we'd really like to start doing a little bit more in the new year. One of our lovely patients, Laura McNeil, actually took the initiative on this, and we want to keep the ball rolling on it because I think it's really important. A lot of women are scared to get their mammograms, and really if you have the support of your friends to come with you, how much more easier would it be?
I was thinking about my friends and how I didn't want any of them to suffer through chemo and radiation the way I had. And I know that one of the best ways to avoid chemo and radiation is to have breast cancer detected early. And so out of a love for my friends, I had invited them to a booby party, which Pureform so graciously allowed me to have.
So it's something we'd really like to do more here in the new year, and you can always call me and if you have any questions and book that.
Be aware of any changes in your breast. Don't be shy to do a self-breast examination. And if there's a new lump or a nodule, don't ignore it. Come and get it checked out.
I just really encourage everyone to have a mammogram, be screened, get it done annually.
Annual screening is paramount.